obviously, being a healthcare company, concerns about compliance, concerns about security are always forefront in your mind whenever you're looking at making any change to your core business application suite or to the underlying network infrastructure. Now, in this situation, it wasn't as concerning as maybe other applications. This is a phone system. It's a tool used by people. We don't really store any patient information on it, so there was less concern about moving to the cloud from that perspective. One other area that we looked at was more of a feature of newer phone systems, the ability to record call conversations. We haven't turned this option on yet. We're trying to take a very conservative approach to this. We're working with our operations people to put together a solid policy in terms of what type of phone calls we're going to record, and also who is going to have access to those recordings afterwards. We also involved our legal department to look at all the legal ramifications of recording patient phone calls. So we're not quite ready to turn that option on yet, but again, it's the conservative approach that you have to take when you're dealing with a very confidential patient information. If it has to do with our core business applications, we'd like to stay at the forefront. We were probably one of the first large healthcare organizations in the tri-state area to move to our electronic medical records package many years ago, and probably the first to quickly get our physicians group up and running on the EMR package as well, and make sure that as we bring on new offices, that's part of their transition. We don't wait to bring them on later, we bring them on now. So when it has to do with core business applications, electronic medical records, and another trend you're seeing now is, now that we have EMR systems, all your clinical equipment in your offices are starting to go from creating paper-based records to now creating digital records that can be viewed anywhere in the world. And when you're done with them, they're just stuck as a part of the patient's record. So when we're dealing with technology in those areas, we're considered a leader in this business, and we want to be at the forefront of all these trends where it makes sense for us. Some healthcare systems, it makes sense to make this jump to the cloud, especially for phone systems. I know our hospital organization, the St. Elizabeth Healthcare, they have 6 major large hospitals here in the northern Kentucky area. They're running on a more traditional phone system. They don't move around much. They're very happy with their solution. However, our company was formed through the merger of 2 organizations, and since then we've been acquiring offices left and right. We're not the only ones going through this transition. All healthcare organizations are going through this transition because there are incentives to get your patients and to get people on EMR systems, incentives with dollars. So we're not the only organization that is growing our physicians group. All of them are out there doing the same thing. So they're all going to have the same problems of buying up these offices and being stuck with a very diverse inventory of phone systems. And I would suspect that they're going to have the same problems when they go to their healthcare organization and try to see how they're going to fit these offices onto their premise-based system there.